reason. The reason I wanted to do a whole segment in this show about fiber, go watch it if you're watching this segment, is because of this fucking bullshit. So here on Good Morning America, there was an interview with the CDC director who's giving us some good news on the COVID guidelines and how the pandemic's going. Oh, great. Good news. Let's watch.
Spreading Omicron variant. Joining us this morning is the director of the CDC, Dr. Rochelle Walensky. Dr. Walensky, I want to dive right in. Thanks so much for being with us this morning. Your agency, you know this, is facing a lot of criticism over these new guidelines over isolation and not.
Now, again, the Delta CEO called the CDC and asked them to change the guidelines, and then less than a week later they did. So that's the main reason why they're criticizing. The CDC guidelines tell you to go to work even if you are sick. They say, or symptoms resolving in their guidelines. So let's say you have a fever of 100.8 degrees Fahrenheit, okay? And then your fever goes down to 100.3 degrees Fahrenheit. That's resolving in the CDC guidelines. Go the fuck to work. That's what they're saying. So again, the CDC is telling you to kill yourself for capitalism. That's what they're telling you to do. There's no ifs, there's no ands, there's no buts. They are telling you to throw yourself in the volcano so that the rain will come. That's what this is.
Not requiring a 5-day test to get out of those isolations. The American Medical Association is going as far as saying they're not only confusing, but they risk spreading this virus even further. It's not a risk.
It's not a risk. That's like saying if I point a gun at your head and pull the trigger, there is a risk that you will be shot in the head. There's not a risk. There's a guarantee that you will be shot in the head. What is this language that they're using? This is you've got the CDC director on. You're asking these stupid dumb fuck questions. This isn't a risk. There's no risk. It's not a risk.
Clarify and say
it's not a risk.
The American Medical.
Like, in what world? Okay, I've got a gun pointed directly at my head, right? And if I pull the trigger, there is a risk that I will die. I know I just said it twice, but I need you to understand how stupid this fucking language is, okay? It's not a risk. It is a guarantee. If you go to work when you're sick, people are going to get sick. It's not a it's a guarantee. This is like in Don't Look Up, right? When the I know I love this movie. I gotta watch it a second time. I've been considering it. But guess what? Okay, when they go to the president and they're like, yeah, and they ask what the percentage likelihood is, like 99.97% that the comet's going to kill all life on Earth. And then they're like, let's call it 70%. That's what's happening here! That's what's fucking happening here! It's not a risk. It is a guarantee. And then people go like, let's just call it 70-30.
Medical Association is going as far as saying they're not only confusing, but they risk spreading this virus even further. Are they wrong?
Let me just clarify and say isolation. We talk about isolation in the context of people who've had a positive test, who know that they are infected. And we have now dozens of studies referenced on the CDC website that have demonstrated that you are most infectious in the 1 to 2 days before your symptoms and the 2 to 3 days after your symptoms. So by 5 days after your symptoms, the vast majority of your contagiousness is really behind you. And what we say at day 5 then is, are your symptoms gone?
All right, folks, I want to bring up the Worldometer page. I didn't have that open in a tab, so give me a sec. Okay, so this interview was done a couple days ago. So let's look at the daily cases. Oh, right, the contagiousness goes down. So these guidelines went into effect like the week of Christmas, right? So around here, these guidelines took effect, right? And then the next week, like, oh yeah, no, it's the vast majority of your contagiousness. Now again, okay, so the CDC guidelines are introduced, right, in this week. The vast majority of your I'm the CDC director, and like, trust me, bro.
Are you feeling better? Is your cough gone? Sore throat gone? And if so, then it is safe to go out if you are wearing a mask all the time. And that means not going out to restaurants, not going out to gyms, not going in visiting grandma, but really conscientiously wearing your mask for those last 5 days. Now, some have said that
that's the other thing. For those last 5 days. She just said it. She said if you are positive, you only need to wear a mask for 10 days and then take it off. Whatever. The CDC, we are in year 3 of this pandemic. Year 4 in some countries, right? No, wait. Year 3 is 19. Okay, so 20, 21, 20. Oh my God. What is time? I don't even know what time is. Okay. But anyway, The CDC, year 3. This isn't January 2020. This is January 2022. They are telling you only need to wear your mask sometimes. It's only 5 days. This is the Centers for Disease Control. Shouldn't they be telling you to wear your mask all the time? An N95? Shouldn't they be mailing N95s to your house every day? The CDC is telling you, oh yeah, you only need it for 10 days, maybe 11.
In not going out to gyms, not going in visiting grandma, but really conscientiously wearing your mask for those last 5 days. Now, some have said that they are interested in using an antigen or a home test at the end of those 5 days. And if people are interested and have access, then they may choose to take that extra step and do that antigen test. We've provided some guidance as to how to interpret that. And that means that if that...
The fact that you have to pay for testing, we're in year 3. This isn't like, whoa, bro, what's COVID, man? Remember when Kamala Harris did an interview and she said, I didn't see these variants coming. That was like right before the Omicron surge. It was like a couple weeks before Christmas. Kamala Harris did an interview with like the LA Times or something. And she was like, bro, these variants, man, like who could have seen that coming? Like, I thought we were out of here, man. Why? Like, we had 2 years to prepare for this. 2 years to utilize the Defense Production Act to mass produce masks and mail them to every house for free. 2 years to develop a significant amount of tests that you can just get one in the mail for free every day. Other countries can do it. Why can't we? Oh, we can. We choose not to because this country fucking sucks dick.
Test is positive, you should stay home for those extra 5 days. But if that test is negative, you should.
Now again, you should. They're using language like should, but then ultimately, it's up to your employer, right? Yeah, you should stay home, except your fucking employer will fire you if you stay home because the CDC guidelines say you don't need to, and your employer is going to cut all the fucking basic bare minimums and make you at risk as much as possible for their profits, okay? So again, the CDC is saying you should do this, maybe, man, and just wear a mask for a couple days, bro. And then, but ultimately, your employer is just going to say no, right? Delta is telling you to come into work if you have a 100.9 degree fever. It doesn't matter how long you've been isolating. If your fever is above or under, rather, 101, come into work. And if it goes up to 101, whatever. I mean, we'll play it by ear,
Out and continue to wear your mask. Now, I've read the AMA statement and I have deep respect for the AMA, but I will also say we've heard a lot of...
This person needs to go to prison. Like, there is, in a just world, right? This person would be in prison. This is eugenics, folks. This is genocide. We are literally living through a genocide of American civilians. A genocide. Because who are the people that are disproportionately affected during this pandemic? The disabled, elderly, minority groups. Right? The rich are mostly fine. Right? This is a genocide. People that have disabilities, right? Because the American system of food in this country has made their bodies disgusting and unable to work. 95% of Americans don't eat enough fibers, right? This is a powder keg waiting to explode, right? This is a genocide. I need you to understand. I don't even know.
Support for ongoing guidance from public health partners, from other clinical and laboratory partners as well.
But is part of the consideration in not requiring a negative test after these 5 days because there aren't enough tests to go around in this country?
We make these recommendations in the context of science, in the context of ongoing epidemiology, and
they make them in the context of science. This isn't based on scientific research or study, but it's within the context of science. What the fuck does that mean? It's in the context of science? What? What?
is feasible in collaboration with our public health and local and state public health partners. And through that discussion and through the discussions within CDC with our own subject matter experts and with the FDA, we made the recommendation, these tests are actually not authorized for the purpose of evaluating contagiousness.
I want to ask you about those encouraging headlines that we're talking about this morning, this new study showing just how well vaccines are working to prevent severe illness. Given that, is it time to start rethinking how we're living with this virus, that it's potentially here to stay?
The overwhelming number of deaths, over 75%, occurred in people who had at least 4 comorbidities. So really, these are people who were unwell to begin with. And yes, really encouraging news in the context of Omicron. This means not only just to get your primary series, but to get your booster series. And yes.
Did you hear that? Did you hear that? That's eugenics. These are Nazis. I don't know what to tell you. This is... Now again, my previous segment was based on how 95% of Americans are unhealthy. 88% of Americans have metabolic syndrome. Okay? The CDC director says it's encouraging that only the disabled and the sick are dying? The media, when asking the question, asks about, oh, there's an encouraging new study. Oh, it's so encouraging. Only the disabled are dying. Isn't that great? Isn't that wonderful? Yay! It's genocide. There is no other applicable term for what we are going through right now. This is a genocide. They are treating this as good news. This is good news in the eyes of the American government and the mainstream media in this country. It's good. It's encouraging and great news that only disabled people are dying. Which, by the way, it's only 75%. But also, have you seen the state of America? Everyone's got comorbidities. Everyone in this fucking country. 95% of Americans don't know how to eat properly. 88% of Americans have metabolic syndrome. So 88% of Americans have at least one comorbidity in that case. This is mainstream genocide and eugenics being presented as good news. Imagine if in fucking 1934, right, there was like an interview with like the fucking Nazi like scientist guys or whatever, and they went on there, we're like, yeah, so we put the Jewish people in these camps, and they're dying, but it's only the Jewish people, so we designed a scenario where people of a certain kind are systematically, displaced in society and then murdered and then killed and then died and then, it's encouraging news. What? Is that a joke? I need to listen to this again. I need you to understand what the fuck's happening here.
75% occurred in people who had at least 4 comorbidities. So really, these are people who were unwell to begin with. And yes, really encouraging news in the context of Omicron. This means not only just to get your primary series, but to get your booster series. And yes, we're really encouraged by these results.
Dr. Walensky, thanks so much for your time this morning.
Thank you.
With a smile on her face. With a smile on her face. Yeah. I just went up there and proudly preached anti-disabled eugenics. Right? The systematic murder of disabled people, elderly people, people of color who are all disproportionately affected by this pandemic. It's encouraging. Do you understand why I go on my show and talk about this stuff all the time? Okay, I'm genuinely asking you. Genuinely. Like, because I don't watch that many other shows on YouTube. Does anyone else in, like, left-wing media ever talk about healthy eating or diets? Does anyone? I don't know. Because every time I talk about this and a new viewer comes in, they go like, oh, I've never heard this before. Like, what the fuck's going on here? Why, like, I don't... Everyone go subscribe to Environmental Coffee House. I mean, if they're doing it all the time, we need to, like, everyone needs to be talking about how we fix the problems. And, like, again, we don't need to wait for the government to fix our own diets. They're literally advocating that if you're disabled, which again, most Americans are disabled when it comes to their diets because of the American system. They designed the game board and you followed all the rules and then they're like, die, bitch. Fuck! Yeah, bro. I'm an anti-capitalist, and that's why I go online and shit talk about how vegans are rich trust fund babies. You know these motherfuckers. I hate these motherfuckers. I hate these motherfuckers. I really do. But I mean, again, they are literally marching you into the death camps right now. They are marching you into the death camps. And every time you pull into that drive-thru, you are stepping up in line. Every time that you fucking throw a microwave fucking meal in there, you are marching forward in the line to the death camps. I don't know what to tell you. And they're going to talk about it on TV with smiles on their face. The little play button's kind of ruining that moment there, but they're like, yep. It's encouraging. Yep, we're killing all the disabled people. That's great news. That's wonderful fucking news. And the CDC director. The CDC director thinks it's good news that disabled people are the majority of deaths. That's good. We are fucked. You're on your own. We're all on our own. The government says, fuck you. They're not going to help. They're not going to give us more money. They're not going to help us get health care. They're not going to stop this pandemic. We are on our own. That's simple. I don't know what to tell you. Anyway, folks, that is the show for